I look forward to seeing my patients and hearing their stories. As a physician or as a healthcare provider in general, you live to serve, and to do your job well is to ease suffering, prevent disease, educate people. You're a teacher. But really, I just enjoy visiting with the people and getting to know them and getting to know their stories.
In early February of 2020, I had a conversation with her about this thing called coronavirus. And I was seeking her opinion about it, what she thought was going to be happening, and certainly there's a lot of uncertainty at that time.
You watch emerging diseases with a certain amount of interest and concern. I think at some point, late January, early February, I began watching it with dread.
But then just a few short months later, Dr. Killian got involved, applied herself into the area of clinical research.
McFarland Clinic established a clinical research department a number of years ago to really support our physicians who were interested in participating in clinical trials. From a patient standpoint, our patients really benefit by having early access to drugs, to vaccines, to treatments that they otherwise would not have access to.
She did the research to find the correct trials that she felt would best fit our patients and would help them in recovering from COVID. So without her enthusiasm, we would not have had these trials here at McFarland Clinic.
And by being in those trials, we were able to host Health and Human Services Secretary Azar for a visit, along with Governor Reynolds, to hear more about what we were doing from a clinical trial standpoint and how it had impacted our communities.
The trials that we have conducted here have brought quicker relief to COVID for patients, a hope, along with that ease in symptoms and knowing that they are helping the greater good.
I couldn't help but reflect on a comment that one of the medical directors made at the time Dr. Killian joined our organization. He said, "She will be a superstar." And no doubt, Dr. Killian, in the minds of her patients and in the minds of her colleagues, she is a superstar.
You know, if you see something that you feel you can make a difference at, I would encourage you to go for it. Whenever the pandemic was coming on, that was a really hard time. And being able to throw myself into the research helped me to work towards a solution instead of being angry all the time about what wasn't happening. Being part of the solution helped me to move forward and move emotionally past that point to where we are today.